Hi everyone, this is Dr. Alison Goggin with Little Black Bag Medicine, and today I kind of wanted to just chat about the concept, which is an emotional one, a spiritual one, an astrology one, if you want it to be, called the wounded healer. And for me, it's an important topic because I find that a lot of women and men too, who are sensitive, empathic, who are open, who are just the most compassionate people that you meet, can also become the most ill people that you meet, where they struggle with a lot of issues that are difficult to treat, autoimmune conditions, and it just stumps a lot of people. And there's a lot of emotional layers to what would be called the wounded healer. So, what this term can mean, and what it means to me, is that when someone wants to heal others, a lot of times they have to go through an initiation. When I think about this, I think of it a lot like a shamanic practitioner or shaman who goes through a difficult illness, a trauma. Sometimes it's a near death experience, and they come through this trauma with the knowledge and the abilities to help people who've gone through the same thing. And I think we all have this, especially if you are a healer or a doctor, a nurse, a therapist, a coach. There's so many of us. If you're helping other people, you've probably gone through this yourself. Um, the other part that I see happening a lot with this with my patients, especially females or the firstborn, is that when they see a family member, usually their mom, go through an illness or a trauma, they want to fix it. They want to save them. They take personal responsibility on for being able to help that parent, and they take on that illness subconsciously, of course. I don't think anybody's ever like, well, I don't want my mom to have cancer, so I'll take her cancer for her. But it becomes something that is deeply ingrained in themselves until they're usually about 8 is when our mentally fully formed subconscious has picked up and just determined our personality at that point, right? So when we get older, we're still playing out these patterns of needing to save people. A lot of people subconsciously seek out situations where they attract spouses, friendships, family, extended family come to them, strangers who are very wounded and use that person to offload so that person can feel better, but that wounded healer is then stuck with the emotions, the energy, the baggage, and it can be very difficult to process. And what they do instead of processing is stuff it deep down inside because they feel like, well, this is my job. I'm supposed to feel sick and sad and help people. And look at all the people who need my help. And it is not good for them. It is not healthy for them. And at some point, I do believe that most people in these types of professions hit a compassion fatigue, and they get run down and they're just done dealing with people because they can't take up anymore, that emotionally, physically, energetically, that they are done taking care of people and they want other people to take personal responsibility, which is important, or they start treating the people around them pretty horribly. So when we come to this concept of looking at, are you a wounded healer? Are you taking on other people's emotions, illnesses? Are you trying to fix everybody around you? I think it's important that you start with your own health first. Where are you sick? What's going on with you? What's constant? What's not changing? What's not resolving after maybe you go through a plan, or maybe you work at some lifestyle changes or add in supplements or oils, and you're just in the same place. Nothing's getting better. Not even the medications are helping, right? This is the time when, if you're already here, or if not, it's also a good time. Anytime is a good time to do this, but to really just evaluate where in your life are you trying to fix things for other people? Where are you trying to take on other people's problems, illnesses, issues? Where are you attracting people that don't want to do the work and they're using you so you do the work for them and you're taking it in? Where in your body are you feeling sick, down? What is not resolving? What are you not able to move forward with? And then what type of people are you working with? What type of people are you attracting? How is your relationship with your family? Do they use you? Do they trust you? Do they have the same issues? Are you going, oh, it's just genetic. This is just the way it is. My mother had this, I had it. It's just in the family. Or are you really taking on the trauma, and what can you do about it? So I guess that's the next question to answer, right? What can you do about it? So after you evaluate that, I recommend EMDR therapy, so eye movement therapy, to help rewire the brain and the subconscious. If you don't have access to an EMDR therapist, using EFT, emotional freedom technique, or tapping can also be really helpful. So you're just tapping on acupuncture points on your face. My favorite person on YouTube is Brad Yates. He is the EFT wizard, and he has so many playlists and protocols. You can just zip right through them. Emotions, pick the emotion or stress that you're feeling. And what that does is it helps break up the energetic patterns as well, and the emotional ones, because you start seeing what's your feelings that are coming up as you're tapping, how you're feeling, what is your body doing. Are things gurgling? Are things moving? Is a headache lifting, or is a headache coming on? And that'll give you a lot of information about how your body is responding to thoughts, patterns, beliefs, sentences, positivity, negativity, and really understand how those are affecting your health. And that's why I wrote my book, Healing the Woman Within, which is right here behind me. You can get it on Amazon, or in my programs, that women become really attached to their stress, and men become attached to their stress as well. But it's almost like a badge of honor that I am sick and I'm carrying this torch to protect and heal and take responsibility for other people. And it does become a generational pattern. And it's something that, if you're listening to this and you're feeling this way, if you're still here with me, it is time for you to break free from that and accept that you are not solely responsible for everybody in your family or on the face of the planet, or every person that you come into contact with. You are not required to heal anybody but yourself. And if you are a healer or in that modality, you cannot heal others until you heal yourself. You're going to keep attracting people who want to dump on you and use you for your energy and leave you. And it's not healthy, because you need those boundaries, you need that protection, and you need to release the need to heal other people. And then once you are healed, once that story is through, you probably will have the strength, the knowledge, the tools, the ability to walk people through that path. And what you'll find is that you're going to be really, really good at helping people who've gone through the same thing. You don't have to heal everybody. You can really focus on working with people who love you, respect you, who have been through what you've been through in the past, and give them really good information, accountability, and support as they're going through this as well. So this is kind of a big weird topic for functional medicine, but I think it's important that it gets addressed from an emotional standpoint, and that these patterns of illness in your life and how you feel about yourself and how you treat others and how others treat you come to light, because we talk about how stress affects your health. Stress affects your health. Stop being so stressed out. But no one's talking about why you're so stressed out, or why you can't manage the stress, or why things keep happening. And this is one of those reasons. So I would love to chat with you. If you have any questions, you can Facebook message me at Little Black Bag Medicine. I always offer a free 30-minute consultation for answering your health questions, brainstorming on how to move forward and what we can do for you, start ordering tests. And then I also offer your Awaken Your Soul Medicine program. So it's a deeper dive program into this type of work, the energetic work, breaking those patterns, as well as the functional medicine, the blood work, kind of brings it all together in a holistic point of view. So that's something that's very special to my heart. You have to apply. So you can message me on Facebook and let me know that you want to apply, or schedule that consult online. Let me know that's what you want to talk about to move forward. So thanks for tuning in today. Have a great day, and we'll see you next time.